Hello and welcome. Today, we're going to talk about something that can be, a little tough to bring up, but it's so important to understand: rectal prolapse. Our goal here is to just give you a clear, supportive guide to what this is and what can be done about it. Look, if you're dealing with any kind of pelvic discomfort or weird changes in your bowel habits, it is so easy to feel like you're the only one going through it. But the first thing I want you to hear is that you're not alone, and there are absolutely effective solutions that can make a huge difference in your quality of life. Okay, so let's just dive right in. Before we can get to the solutions, we have to really understand the problem. So let's start with the big question: what is rectal prolapse anyway? All right, first up, let's get to the bottom of what this condition really is, and just as important, what it isn't. There can be a lot of confusion around this, so we're going to clear that up right now. So, in simple terms, rectal prolapse is when the rectum, that's the very last part of your large intestine, basically turns itself inside out and sticks out from the anus. Now, the key phrase here is full thickness. This means all the layers of the rectum wall are involved, not just the inner lining. To really wrap your head around this, let's use a quick analogy. Just picture your rectum as a simple tube, held up in place by all the muscles and tissues around it. For some people, this whole thing actually starts on the inside. The rectum begins to fold in on itself, kind of like how an old-school telescope collapses. This is what doctors call an internal prolapse. You can't see anything from the outside, but you might definitely be feeling the symptoms. Now, if that telescoping action continues, the rectum can slide all the way down and actually come out through the anal opening. And that is the full external prolapse that most people think of when they hear the term. And this is why that full thickness thing is so important. A lot of the symptoms can feel similar to other things, like hemorrhoids or what's called a mucosal prolapse, which is just the lining. But knowing the difference is absolutely critical, because it tells your doctor if they need to treat just the surface or if they need to fix the entire support structure. So now, we've got a handle on the what. Let's talk about how it actually feels. What are the signals your body might be sending you? And what are some of the reasons this might be happening in the first place? It's all about listening to your body. If you're dealing with this, some of these are probably going to sound pretty familiar. Things like a feeling of pressure or a bulge down there, or that really frustrating sense that you just can't completely empty your bowels. Maybe some leakage of mucus or stool, or even just being constipated and having to strain all the time. These are all classic signs. So why does this happen? Well, the truth is, we don't know the single exact cause. What we do know is that it's tied to the weakening of all those pelvic floor muscles and ligaments over time. You can think of it like a supportive hammock that's just gotten stretched out. Things like chronic constipation, the strain of childbirth, and even your genetics can all play a role. Okay, understanding the what and the why is huge. The next step is getting a really clear, accurate diagnosis. So let's just walk through what that looks like so there are no surprises and you know exactly what to expect. The whole process is actually pretty straightforward. It basically boils down to three main steps. It always starts with just a conversation, you talking about your symptoms and your medical history. Then comes a physical exam, and in some cases, you might need some specialized tests to get the full picture. One of the coolest and most helpful tests is called a defecography. Seriously, think of it like your doctor getting to watch a movie of what's happening inside your body while you have a bowel movement. This little film gives them a real-time view of how everything is working or not working, which is just priceless for planning the best possible treatment. So once the diagnosis is confirmed, the conversation usually turns to treatment, which for this condition is almost always surgery. Now, I know that word can sound a little scary, but stick with me because we can basically simplify all the options into two main paths. And here's a wild fact for you. If you look at all the medical books, there are over 100 different types of surgery that have been described to fix rectal prolapse. I know, that sounds insane. But the good news is every single one of them falls into one of two basic categories. Those two main paths are the perineal approach, which means the surgery is done from below, and the abdominal approach, which is done through the belly, usually with tiny incisions. The from below repairs are often a good choice for older or more frail patients, but there's a higher chance the prolapse could come back. The abdominal repairs, on the other hand, usually have lower recurrence rates. A really common and modern abdominal surgery is something called a ventral mesh rectopexy. During this procedure, which is usually done with a tiny camera, the surgeon uses a piece of surgical mesh to create a new supportive scaffold. It basically lifts the rectum back where it belongs and secures it in place. So with all these different options, how in the world do you and your doctor choose the right one? Well, this is maybe the most important part of the whole conversation, because it's not about finding an answer. It's about finding the answer that's right for you. And I really want this to sink in. There is no single best or gold standard operation that works for everyone. The best choice is always a team decision made by you and your surgeon together. It's based on your health, your specific symptoms, and frankly, what your goals are for getting back to your life. So if we boil this all down, what do you really need to remember? First, this is a fixable problem. Second, the treatment has to be tailored specifically to you. Third, the whole point of this is to improve your quality of life. That's the goal. And finally, being open and honest with your doctor is the most powerful tool you have. Understanding what's going on with your health is the first real step to taking back control. I hope this guide has given you some clarity and maybe a little more confidence. So the only question left is, are you ready to take that next step toward feeling better?